Hello, this is Dr. Mukhtar Yerima. Welcome back to my channel. Today I'm going to talk about another interesting sleep condition called night terrors. Night terrors are also called sleep terrors. They are a form of sleep disorders or sleep disturbances that occur during non-rapid eye movement sleep, also called slow wave sleep. The slow wave sleep, as we've discussed previously, is the form of sleep that we need to refreshen our brain, and it is the deepest part of the sleep, and it is the sleep that is more likely to occur in the early hours of the night when we first go to sleep. And that's why night terrors are more likely to occur in the first part of the night, maybe in the first third or so of the night. So what are night terrors? Night terrors are a condition in which an individual, usually a child, during sleep in the early hours of the night suddenly become partially awakened, and he is partially awakened because he is technically still sleeping. He will appear confused, he will appear disoriented, and he will appear completely unaware of what's happening in his surrounding. And when he is so partially awoken, he will begin to scream or cry inconsolably. He will do that for a number of minutes, and after that, he will go back and lie down and continue sleeping. In the morning, there is no going to be recollection of this event at all. So while he is screaming and crying inconsolably, there is associated features suggestive of increased autonomic arousal or increased sympathetic drive, and that is evidenced by increased heart rate. The pupils will be dilated, the pulse or the heart rate is beating, the heart is beating very fast, there's going to be palpitations, and if you were to check the blood pressure, it's going to be very high. He may be sweating. So all those things will happen for a few minutes, and after that he will go back and he will continue sleeping. In the morning, there is not going to be recollection at all whatsoever of the fact that this thing has happened, and he will have little or no recollection of any dreams. There are times when some patients might recollect that they've dreamt of something, maybe something terrifying, but in most cases, there's really no recollection of any dreams. And this is in contrast to what happens in nightmares. In nightmares, there is usually a vivid recollection of a certain dream, a certain very terrible dream that the person has had that was so bad that it woke the person up. In night terrors, there is no such thing. There is little or no dreams. Night terrors are more likely to occur in children. They rarely occur in adults, but most commonly, almost exclusively, they occur in children. And after some time, even children tend to outgrow it. And that's why the time that the night terrors begin, or the age of onset of night terrors, is usually very early childhood. And as the child grows, the prevalence or the chances of having night terrors tends to reduce until it very rarely occurs in adults. So it is a condition that children can outgrow. So what causes night terrors? Night terrors are probably caused by the immaturity of the neural networks of the brain. At that age, at that time, the brain is not yet matured. So the connections between the neuronal cells, one cell is usually connected with another. That connection is not yet fully achieved, or it is not really matured. So that makes it difficult for children to maintain or to sustain sleep during that deep part of the sleep, during the non-rapid eye movement or the slow wave sleep. So that is believed to be what is responsible for causing night terrors, and that is why it is more commoner in children. Of course, adults may have night terrors, but they are not as often as they occur in children. So what is the treatment for night terrors? They do not need to be treated except if they are so severe, or if they are so frequent, or if they are associated with significant distress in the parent or caregivers and in even the person themselves. That is when it might even be considered a night terror or a sleep terror disorder. That is when it might need to be treated. Otherwise, in the normal infrequent occurrences of night terrors that normally occurs in most children, it does not need to be treated. However, parents should know that because oftentimes parents are usually distressed when they see their child who has just gone to bed suddenly awakening and appearing terrified and screaming inconsolably. It disturbs the parents. They might even begin to give it some meanings that maybe some creatures or maybe some demons are awakening their child and preventing their child from sleeping. And that might probably cause them to start looking for some forms of interventions and what have you. So, but once the parent knows that what is causing this condition is not any demons, but that the condition is caused by the immaturity, relative immaturity of the brain of this child at that age, and that they tend to outgrow it, that tends to reassure the parents. All right, but how is night terrors different from nightmares? Or are we talking about the same thing when we say night terrors? Is it the same thing with nightmares? No. Night terrors are different from nightmares. They are different conditions, and there are a number of ways in which they differ. Now, one of these differences is that in nightmares, the sleep disorder awakens the child. In both conditions, both night terrors and nightmares, the person is awoken, right? But like we said, in night terrors, the child is just partially awoken, and that's why we said the child is still technically asleep. Whereas in nightmares, it is a very terrible dream and it wakes this person, and as soon as the person wakes up, the person becomes fully alert. The person becomes, in fact, fully oriented. He knows what's happening. He knows where he is. And that is what happens in nightmares. Whereas in night terrors, the person does not even know what they are doing. It's just that it's just a disruption in the normal flow of the deep early part of the sleep. So this is a significant difference. Secondly, nightmares, like we said, are dreams. Therefore, there are vivid dreams. There are very vivid dreams. However, the dreams are usually terrible, or they are bad, or they are uncomfortable. But in any case, they are dreams. Whereas in night terrors, there are no or little dream imagery. So that when the person wakes up in the morning, hardly does he ever remember that he has done any dream or he has gone through any form of dream. Rarely they remember some fragments of dreams here and there, but in most cases, there is even no any dream imagery in the first place, which means they've not seen themselves doing something or participating in a certain dream in night terrors. Whereas in nightmares, it is a dream and they have a vivid recollection of that dream upon waking up. So if the person had a nightmare, as soon as they are awakened, they immediately remember that they've been in a very terrible dream, and these are the details. So they are able to remember the complete details of the dream they've been in nightmares. Whereas in night terrors, they are not even oriented in the first place. They are still confused. They are still technically asleep. So you don't even expect them to remember anything because they are still sleeping. And in the morning also, people who have had nightmares are able to remember all the things. They were able to remember that they had a terrible dream that woke them up from sleep, and they will tell you the complete details of the dream. In the morning, people who have had night terrors will not even remember that they were awoken, because they were not awoken, like we said. There was just a disruption, a partial awakening. There was just a partial awakening, so therefore they are not expected to remember anything. Another difference between nightmares and night terrors is in the age groups that are affected by the condition. Nightmares, although they are also a little bit commoner in children, they tend to occur in all age groups, whereas night terrors tend to occur almost exclusively in children. Another difference between nightmares and night terrors is that nightmares tend to occur during REM sleep, that is, during rapid eye movement sleep. And since we said that rapid eye movement sleep is commoner towards the end of the night, that is why nightmares are more likely to occur in the later half or the later part of the night, whereas night terrors, since they occur in the non-rapid eye movement sleep or the slow wave sleep, they are more likely to occur in the early part of the night. So by and large, these are a few differences between nightmares and night terrors, and these are two distinct conditions, and these are conditions that should not be confused with one another because they tend to have slightly different causes. For instance, nightmares are more likely to occur if the person has some other medical or psychological problems, or if they are on some certain medications that increase the time that they spend in REM sleep. Whereas night terrors are, since they are commoner in children during development of the brain, they are just seen as a mere developmental process of the brain, at which time the brain itself is not fully matured. Therefore, from time to time, it makes the child have issues with maintaining sleep, and therefore, he tends to have arousals from time to time from that deep sleep. So, by and large, these are the slight differences between nightmares and night terrors. And thank you for listening.